checking in on the stocks behind the story, Pfizer and Moderna. The concern now, of course, for countries like Canada is simply procurement and supply chains. How do we get our hands on more supply? That's something that we're hearing from premiers. They would like more vaccines in order to deploy them. So where do we stand and how soon can the vaccines be delivered? Anita Anand is our Public Services and Procurement Minister. She's with us now. Minister, we appreciate your time today. Thanks for being here.
Hi, Amanda. Great to be here.
So let's start right there. You've heard the premiers. We just heard from the CEO of the University Health Network. We need more vaccines. What are you telling them?
Well, Amanda, I just want to start by saying that we have procured the highest number of doses per capita of any country in the world. And we were able, because of Canada's very strong negotiating position with the vaccine manufacturers, in particular, one of the first countries to sign with Pfizer, one of the first countries to sign with Moderna, we were able to be very strong in pressing for early delivery of their vaccines prior to the holidays. And indeed, we were one of the first countries to start vaccinating our populations. And now we have vaccinations occurring in every jurisdiction in this country. In terms of what we're hearing from the province and the University Health Network, I want to be clear that we are working very collaboratively with all levels of government to ensure that the vaccines that we have procured and that are coming into Canada are indeed provided to the provinces. We have provided them with the information and the schedules for the delivery of those vaccines. The deliveries are ramping up as we speak. And so in terms of running out, it has to be kind of considered in the context that we are working with them and we have provided them with clarity regarding how many doses in particular will be coming in. Q1, we're looking at a total of 6 million doses from both Pfizer and Moderna alone. We are going to see over 1 million doses coming into Canada in January. That's going to ramp up to 2 million doses in February. And these numbers are being relayed to the provinces and the territories by the Public Health Agency of Canada, of course, and Major General Danny Fortin, who's on the front lines working with them.
So I understand that in terms of our total procurement, we look good. In terms of the pace of supply, though, there are concerns here. You will have heard them. As I understand it, we got 124,000 doses of the Pfizer vaccine across 68 sites this week. Across 68 sites, that's not a ton. And we are already hearing from hospitals that are running out, those who are concerned about second doses. They're using all of their supply on first doses. In terms of just the supply chain, is it where it needs to be? I know this is a fast-moving project, and you probably have to adjust as you go. How much learning are we doing, and how can we get this supply smooth?
It's the largest mass vaccination campaign in Canadian history, so that is a massive, massive undertaking. But I don't buy into the frame of running out of vaccines simply because we have provided the delivery schedules to the provinces and they are able, therefore, to plan their vaccinations on the basis of the delivery schedules. And so it is really important to remember that we are ramping up quickly, that there will be more and more vaccines available to at-risk populations throughout the first quarter and then by the millions and millions into Q2 and Q3. But it is really important to remember that there is transparency and collaboration in terms of what is coming into Canada and when from a federal perspective to the provinces.
There were questions today about other countries paying more. How do you respond to that? Is there any renegotiating to be done here? Could we up our price and get our hands on our volumes faster?
Well, listen, when we started negotiating with these companies at the beginning of August and moving on through August and September, we left no stone unturned at that time. We put everything on the table. We left no stone unturned because we know the importance of vaccines as a way to emerge from this pandemic. So we continue to press our suppliers each and every day. I've been on the phone all week with our suppliers to impress upon them the urgency of the situation and to indeed ensure that our vaccine deliveries are accelerated insofar as that is possible in this country. We have to remember that every jurisdiction is asking the same suppliers, a handful of suppliers, the very same questions. And the fact that Canada was one of the first countries to inoculate its citizens and to begin that process is indeed a mark of the strength of our negotiating position, the strength that we are coming to the table each and every day. And we will not rest. Indeed, I will not rest until we have enough vaccines in this country to inoculate everyone who wishes to receive a vaccination.
Yeah, Minister, I don't doubt rest is not something high on the list of things you get to do these days. We do, though, face a rising case count. We are in a difficult second wave. More Canadians will die, without question, than we had hoped before a vaccine rolls out. What's the conversation around the cabinet table about tougher measures? We're seeing some provinces move in that direction. Do we need to do even more than we did in the spring to try to rein this in?
There is an across-government, indeed across-country conversation about what more can we do in order to protect the health and safety of Canadians. When I began in the early spring, working very hard to procure PPE, that was the goal. We need to protect the health and safety of Canadians. We moved to rapid tests. We moved to vaccine procurements. And now we are again focused on what more can we do to support the provinces and territories, indeed Canadians at large, to assist them in emerging from this pandemic. We are all in this together. We need to continue to keep our heads focused on the economic and health risks that this pandemic poses, and I am deeply committed to this effort.
Minister, we appreciate your time today. It is great to have you with us. Anita Anand is Canada's Minister of Public Services and Procurement.